the stye or chalazion, painful lid swelling. A stye, also known as a hordeolum, is a bacterial infection of the glands within the eyelid. It results in a red, swollen bump that can be painful. Chalazion is a similar condition that occurs when a gland within the eyelid becomes blocked and results in a painless, cyst-like swelling. Treatment for a stye typically involves the use of warm compresses and topical antibiotics. In severe cases, oral antibiotics may be necessary. If the stye does not respond to medical treatment, surgical incision and drainage may be necessary. Surgical treatment for a chalazion is a procedure called incision and drainage. The purpose of the procedure is to remove the blocked material from the affected eyelid gland and allow it to drain properly. The surgery is typically performed under local anesthesia and takes about 10 to 15 minutes to complete. During the procedure, the surgeon will make a small incision in the affected eyelid gland and remove the blocked material. The incision is then closed with sutures or left to heal on its own. In some cases, a corticosteroid may be injected into the affected gland to help reduce inflammation and prevent recurrence. After the surgery, it is important to keep the affected eye clean and to avoid touching or rubbing the eye. The use of warm compresses to affected eyelid can also help speed up the healing process. Pain and swelling are common after the procedure, but they should subside within a few days. Differential diagnoses for styes include blepharitis, which is inflammation of the eyelid margin, and conjunctivitis, which is inflammation of the conjunctiva. Additionally, chalazions can be differentiated from other eyelid diseases, such as basal cell carcinoma and squamous cell carcinoma, by their lack of malignancy and slow progression. It is important to note that surgical treatment of a chalazion is not always necessary, and many chalazion will resolve on their own with the use of warm compresses and topical antibiotics. If you are experiencing symptoms of a chalazion, it is important to see an ophthalmologist for an accurate diagnosis and appropriate treatment.